Julia, as I've talked to our healthcare leaders, there has been a recognition that this is a complex question. It's not a simple question of saying that the best thing for a senior is always to send them into a hospital setting. What I think I would say to take your question and broaden it further is we need some real serious changes in the approach to nursing homes. Although the city doesn't have a direct role in nursing homes, and because I don't experience these issues because we don't regulate the nursing homes, what I'm seeing on a human level is unacceptable. But I think this crisis is pointing out that we need a different and better approach to nursing homes going forward.
And you're focusing those efforts where the threat really exists, which is in our senior population. So we did very early with the nursing homes, we restricted visitation and we prevented hospitals from discharging COVID positive patients back into nursing homes. That's like a tinderbox if you let that happen.
Vulnerable people are going to die from this virus. That is going to happen, despite whatever you do. He worked it out so we always had available beds. Nobody was deprived of a bed or medical coverage in any way. And still people died. Still people died. Older people, vulnerable people, are going to die from this virus.
Our data is available. Our data is transparent. In fact, Dr. Birx has talked multiple times about how Florida has the absolute best data. So any insinuation otherwise is just typical partisan narrative trying to be spun. And part of the reason is that because you got a lot of people in your profession who waxed poetically for weeks and weeks about how Florida was going to be just like New York. Wait 2 weeks, Florida's going to be next. Just like Italy, wait 2 weeks. Well, hell, we're 8 weeks away from that, and it hasn't happened. Not only do we have a lower death rate, well, we have way lower deaths generally, we have a lower death rate than the Acela Corridor, D.C., everyone up there. We have a lower death rate than the Midwest, Illinois, Michigan, Indiana, Ohio. But even in our region, Louisiana, Mississippi, Alabama, Georgia, Florida has the lower death rate, and I was the #1 landing spot from tens of thousands of people leaving the #1 hot zone in the world to come to my state. So we've succeeded, and I think that people just don't want to recognize it because it challenges their narrative, it challenges their assumption, so they got to try to find a boogeyman. Maybe it's that there are black helicopters circling the Department of Health. If you believe that, I got a bridge in Brooklyn I'd like to sell you.